So the first question is, what does your company do? And more importantly, why does it impact and change and improve health equity? What are you doing in the health equity realm?
So I'm going to start by healthcare delivery in rural America is not a little broken, it's massively broken. 60 million Americans live in rural communities, about 20% of our total population, and yet 80% of these rural communities are medically underserved. So 2/3 of primary care shortages happen in rural counties. People who live in a zip code designated as rural have a 23% higher mortality. So Homeward is catalyzing a sea change from health scarcity to abundance for rural communities and fulfilling the promise by connecting rural Americans with resources to be healthy. We address unique challenges through a hybrid model that combines digital tools with in-person support to build trust and scale. Through our tech stack, we maximize provider efficiency, reduce administrative burden, and enable timely and personalized care. Today, we work in partnership with insurance companies to provide care for Medicare Advantage beneficiaries. We take full financial accountability for entire rural communities across Michigan and Minnesota. Through our value-based care model, we align incentives with improved health outcomes. We connect the members with local resources and improve quality of life. We're working very closely and tightly in partnership with the existing healthcare providers and ecosystem in rural America.
I want to know a real example from each of you of where what you did moved the needle with one of those, with an underserved group, and they were at some point before and they were at some point after that made a difference because of what you guys and what your organization, your companies and products did.
So our Homeward navigation is our approach focusing on managing the entire rural county through a combination of local providers, health system partnerships, technology, connection to local resources, and then our own clinical services. And when we enter a county, well over half of the people in our rural counties already have a primary care doctor, or they think they do. And still, there is a need to improve outcomes through the combination of the value-based care enablement services on behalf of health systems and bringing additional clinical capacity. When we launched and engaged members in Minnesota and Michigan, we've successfully been able to close 2.9 clinical care gaps per engaged members. 2.9 is a large number, and this is very tangible impact in these communities. And Medicare Advantage beneficiaries in rural communities have very high rates of chronic conditions relative to their urban counterparts. So lots of good work here to do.
And I want to raise the ugly point that you may have noticed there's an election coming up, and you may also have noticed that currently in the current administration, the health equity, diversity, inclusion, all that good stuff is actually right there in CMS policy. It may not be, depending on who wins coming up in November in the US. So I don't know who wants to go with this, but what do you think that's going to mean for your work? Does anybody think that that's going to change anything? Are you going to have to double down on stuff? Are you going to have to change the way you behave? I want to get some things about where do we think health equity is going to be as a principle, in January, particularly if one side rather than the other wins.
Red and blue states all have rural parts to them. People who live in rural communities are white, black, brown, gay, straight, non-binary, different religions, and yet they have worse outcomes. We're going to stay the course.